When we think about our skin, we often just think about what we see on the surface. But the skin, being the largest organ in the body, can be significantly affected by lymphedema. Hi, my name is Kathy. I am a registered nurse, registered massage therapist, and certified lymphedema therapist. This video is the second in the Pillars of Skincare videos. You will want to watch what happens to your skin when you have lymphedema video to have a better understanding about why skincare is so important with lymphedema. In this video, I'll be giving you ways to protect and care for your skin in order to help break the cycle of lymphedema progression. To review, lymphedema begins when lymphatic vessel function is disrupted. This leads to a buildup of fluid, protein, and waste in the tissue spaces, which increases inflammation in the tissues. Over time, changes occur in the skin and underlying tissues, resulting in increased limb size and limb shape changes. This further disrupts the lymphatic vessels, and the cycle of progression continues unless strategies of self-care are used. One of these strategies is skincare. The goals of skincare aim to prevent injury of the vessels, decrease inflammation and the risk of infection, prevent tissue changes, and reduce or maintain limb size and limb shape. With lymphedema, swelling from fluid buildup stretches the skin, making it more fragile and prone to dryness and cracking. Reduced circulation and lymphatic function mean fewer essential nutrients and immune cells reach the skin's surface, while less waste and fluid can be removed. This combination weakens the skin's ability to repair itself. The natural balance of oils and moisture is also disrupted, leaving the skin less effective at deterring infection. As a result, people with lymphedema are at higher risk for skin complications, including bacterial and fungal infections. Maintaining skin integrity through proper care is essential to help protect against these risks and support overall skin health. Taking care of the skin from the outside involves measures that soothe and protect the skin's surface and taking steps to protect the skin and reduce infection risk. Some general protection measures include washing with pH-neutral soaps or body washes and drying your skin well with the least abrasive methods, such as patting dry instead of rubbing. Ensuring that your skin folds are kept clean and dry, and monitoring your skin for cuts, scrapes, and insect bites. Using careful nail care and monitoring for ill-fitting compression garments, shoes, and clothing that could cut in or damage your skin. When you go into a chlorinated pool, make sure that you rinse off afterwards so that the chemical does not irritate your skin. Some people also are more sensitive to perfumed skincare products, so using a non-perfumed product would be best. Now let's delve into the differences between lotions, emollients, and urea-based creams and when they're used. Lotions absorb quickly but are less effective at deeply moisturizing dry or compromised skin. They can be useful for mild lymphedema or non-swollen skin areas if a lighter product is preferred. Some examples could be Aveeno, CeraVe, or Cetaphil. For lymphedema-affected skin, creams or ointments known as emollients are often more effective. They absorb well and are oil-rich and form a protective layer on the skin. Used daily, they're ideal for very dry, cracked, or vulnerable skin. Urea-based creams are usually used for very thick, very dry, scaly skin. The main ingredient, urea, draws moisture in and gently exfoliates at the same time. These creams are not for use on broken or open skin. Taking care of the surface is only one way to help your skin. You can help reduce inflammation and skin changes with dietary changes as well. It's well known that a diet high in processed foods, sugar, and chemicals can disrupt the gut microbiome to promote something called leaky gut. Over time, this can create whole body inflammation that can cause chronic problems in many organs. The skin is not left unaffected. There are many ways to start protecting your gut lining, and it would be wise to consult a nutritional health professional so you get a plan suited for your particular health situation. With the fluid buildup associated with lymphedema, there is always inflammation occurring within the layers of the skin, and this inflammation is associated with causing tissue thickening, skin dryness, and decreased skin immunity. Many nutritional experts suggest eating foods such as berries and healthy fats like olive oil that have anti-inflammatory properties. These can help decrease inflammation in the body, which will indirectly help your lymphedema. Maintaining a healthy weight is suggested by health professionals because obesity and being overweight is associated with the progression or worsening of lymphedema. And some studies have even shown that weight loss helps reduce the effects of chronic lymphedema. Therefore, taking a whole foods approach to eating with a focus on eating foods that decrease inflammation, protect the lining of your gut, and maintaining a healthy weight is an approach that ultimately benefits your skin. Now let's talk about the importance of hydration and drinking water. Water makes up the majority of the adult body weight and is the medium for nearly all cellular activities. Every organ, tissue, and cell requires water to function properly. Water helps maintain a stable body temperature through sweat and breathing. It absorbs and distributes heat within the body. Water is essential for blood volume and blood pressure and lymphatic fluid. It transports nutrients, oxygen, hormones, and waste products. Water also lubricates joints, cushions the brain and spinal cord, and moistens tissues in the eyes, mouth, and digestive tract. Water is directly involved in breaking down large molecules during digestion. It helps in energy production in the body and assists the liver and kidneys in removing toxins. Water can be lost from the body through sweating during times of heat, when we exercise, or even when we're ill, if we have a fever and we're sweating, or if we lose fluid through vomiting or bouts of diarrhea. We can lose water vapor through respiration, especially in dry or high altitude environments, and through drinking caffeine and alcohol that act as mild diuretics. Even as we age, we have a reduced thirst response and lower water content in our tissues, which increases the risk for dehydration. Drinking water is the best and most efficient source for replenishment of body fluids. Food sources can include fruits with high water content, such as watermelon or oranges. Vegetables such as zucchini and celery can add up to 20 to 30% of daily fluid needs. Research has shown that up to 75% of adults worldwide are chronically dehydrated. Adequate hydration plays such a large role in how our bodies stay healthy. Let's now take a look at how dehydration affects lymphedema and why balance is necessary. Water in the body acts as a vital transport medium. In the case of the lymphatic system, it relies on water to help carry the proteins, waste products, and immune cells out of the tissues and into the vessels as lymph fluid. When you're dehydrated, there is less fluid in the tissue spaces available, making lymph transport slower and less efficient. In addition, the lymph fluid becomes thicker, making it harder for the lymph vessels to pump it through and move it through the system. This creates stagnation in the tissues and more swelling. Dry, fragile skin occurs because of dehydration. The skin becomes less elastic and is more prone to cracking, which compromises the skin integrity, increasing your risk for infections such as cellulitis. Dehydration also slows tissue regeneration, making any skin abrasions or wounds heal more slowly and inefficiently. Well-hydrated tissues are more supple and responsive to manual lymphatic drainage and compression therapy. However, dehydrated fibrotic tissues become less responsive, making lymphedema therapy less effective. So we've seen how dehydration can negatively affect our bodies. While hydration is important, balance is the key. Maintaining fluid balance is orchestrated and balanced by our bodies every minute of the day. Daily fluid shifts are influenced by what we eat, how active we are, or even the weather. If you drink too much fluid, your kidneys will just simply excrete the excess in order to maintain fluid balance. Too much water intake can backfire. In people with heart, kidney, or even advanced lymphatic dysfunction, overhydration dilutes the blood to cause low sodium levels. It can increase blood volume and therefore increase blood pressure and it can potentially worsen swelling. One way to monitor your hydration status is by checking the color of your urine. You get a thumbs up for pale yellow urine. Clearly, it's important for lymphedema to take care of the skin both from within and from the outside. And diet and hydration play an important role in skin care for lymphedema. Thanks for watching today, and if you found this video helpful, please like and subscribe my channel. Also watch for my other videos on self-care for lymphedema. See you in the next video.